Well, good afternoon, everybody, and welcome to today's Sean and Parker Center for Allergy and Asthma Research webinar. I'm Tina Cinder. I think most participants on here know me already, but I'm an allergist immunologist and I direct our S&P clinical trial research unit. It is my privilege today to introduce Marta Matthews. She's a consulting family therapist whose work centers around supporting children and families participating in our food allergy clinical trials. And Tamara Hubbard, a licensed clinical professional counselor and founder of the Food Allergy Counselor website, which has a lot of resources to support individuals and families with food allergy. And Marte first introduced me to Tamara's website a few years ago. And since then, I've shared it with my colleagues, with friends, with families in clinic. Tamara recently published a book focused on this topic and supporting families and children with food allergy. So I'm so excited to hear Tamara and Marte's conversation today and just looking forward to learning more from you both and on this topic. So thank you.
Thank you so much, Tina. That was a very kind introduction. I really appreciate it. I am so excited, Tamara. You are my friend, you are my colleague, you are my mentor. You were the one who introduced me to acceptance and commitment therapy, which is featured really prominently in this book. And we're going to be talking a little bit about what that even means. As Tina mentioned, you've created so many wonderful resources for food allergy families. And then last fall, through Johns Hopkins, you published May Contain Anxiety, Managing the Overwhelm of Parenting Children with Food Allergies. It's just an absolutely perfect title.
Thank you so much. First of all, thank you for having me. And real quick on that title, I have to give credit to a nurse practitioner friend of mine who said, why don't you incorporate may contain, the play on words? And a title was born. So,
It's
yeah.
perfect. It's perfect. And I really appreciate how you talk about right from the very beginning of the book, you're a licensed therapist and you're a food allergy mom. And that is so important because it really shows right from the start that that you really get it, right?
Mhm.
As a professional counselor, as a parent of a child with food allergy, would you be willing to share part of the introduction where you talk about how you got started in food allergy counseling?
No, I started off in substance abuse. Again, I'm a trained marriage and family therapist like you are, Marte. So I did a lot of couples counseling. Please don't mind my dog in the background who's exhibiting some OCD-like behaviors, which is perfect for the topic. But yes, my son was diagnosed when he was 3. And so I introduced this in the introduction of the chapter to sort of set up the fact that, like you said, I'm not just a clinician who is trained in mental health and family systems and can apply that to food allergy, but I also live this daily. So one of the things towards the end of the introduction chapter I say is, you might be having this thought as you pick this book up and saying, well, I know I'm anxious about allergies, but shouldn't I be? Won't my anxiety help me keep my child from getting very sick? So again, that familiar thought that we have as allergy families of like, it's my anxiety that keeps my child safe. I too felt that way when my son was first diagnosed. And so I'm familiar with that thought and feeling, which is prominent throughout the book. But then I go on to say, and I'll read this little section that kind of introduces that pivot and why I do what I do now and wrote a book about it. I said somewhere along the way, my goal of just getting through each day as an allergy parent became a goal to teach my son that he could be resilient with a food allergy, even at a young age. I couldn't imagine our family living in fear our whole lives. But I knew that if I wanted my son to learn how to be resilient, it was up to me to pave the way first. While living with a food allergy was scary, I needed to teach myself and then my son how to find a workable balance between seeking safety to avoid reactions and enjoying life's experiences. It was my job as the parent to help us both work towards accepting, adjusting, and adapting to this new reality. And so that's exactly what this book is meant to help other families do.
Thank you so much for reading that part of the introduction. Of course, I'm anxious. My kid has food allergies.
Mhm.
Yeah, right. It's validating, it's sympathetic, but it's also empathic with
Yeah.
parents because this is the lived experience, right? One of the things that I found so insightful, moving to the next section of the book, is that food allergy anxiety feels so overwhelming. You really were able to crystallize it down into some specific narratives, specific thought patterns that tend to happen pretty often for food allergy families, not just worrying about everything, not
Mhm.
random, but some
Mhm.
very specific narratives. Can you talk a little bit about those narratives?
So these are the sort of internal beliefs and thoughts and rules, if you will, that lead us towards rigid behaviors. There are things that may not be based in fact or things that clinicians, allergists, nurses share with families, but ways of living because we're responding to the anxiety and fear we feel about keeping our child safe. One of those common internal narratives that I find and why I had to put it in the book was that there's that narrative that says this is not what I expected, and that is rooted in grief. And that's not always talked about. People come into the allergist or the allergy clinic, usually because they've had an allergic reaction, they get referred. They then get the diagnosis of the food allergy or food allergies. They're given the basics on how to go forth and live, have an epinephrine auto-injector on them at all times. And then they go into action mode because they're anxious and it's overwhelming. And so they need to just learn all of this. There's not often a time to acknowledge and validate and process the grief that comes along with receiving this diagnosis and making these adjustments to life with food allergies. But of course, grief is part of this process for these families. And I think it's important not only for families to hear this, but clinicians so that they can meet these families with that compassion and maybe even name it. You might be feeling some grief with this diagnosis, and that's okay. It's the loss of normalcy. It's the loss of, now I'm constantly thinking about an allergic reaction and being afraid of that, the loss of relaxation and sort of being a relaxed parent, if you will, the loss of what you expected for yourself and your child's life and your experience as a parent. Now, it doesn't mean that the life of your child is going to be as hard and awful as your mind may tell you. And I say that up front in this book. But these are the kinds of feelings, the grief, the sadness, the trauma that show up initially. So this not what I expected narrative is huge for families. Not all, but many families living with food allergies.
I love the example that you gave in the book of this mom who had a picture of what her child's first birthday was going to look like
Yeah.
and smashing the cake and with an egg and dairy allergy in that particular case. And she just felt like, I can never let my child eat birthday cake. And the loss and
Yeah.
poignancy of that until she was able to really process that
Yeah.
information with her allergist and get clear on there are ways you can find cake recipes
Yeah.
that will work.
Yeah. So I think for clinicians to expect these feelings and maybe even name them, give families space to say, you know what, I'm sad, I'm grieving. So they can open up and say things like in that case where I'm envisioning I can't do all these things. And clinicians can come back and say, hang on a minute. Yes, you can, but let's take this one day at a time. We're
Mhm.
just learning how to live with this. But please reach out with any questions if you feel like, you're too scared to do things. We'll clarify and see if that's too risky for you guys to do. Just
Yeah.
open the door to the conversations and the feelings.
I feel like we went kind of deep into talking about that first section. What I'd love
Yeah.
to do is to back up just a little bit. Would you just give people an overview of the kind of topics that are covered in the book just by reading the table of contents, just the names of the different chapters?
Sure. So obviously the introduction, I titled it, Are You Ready to Feel Less Overwhelmed About Parenting a Child with Allergies? And yes, the answer is usually yes. The first chapter is called Exploring Unhelpful Allergy Parenting Narrative. So that's kind of what we were talking about, the thoughts and rules that these parents create that are usually unhelpful and life-limiting. The next chapter, I should say, is Recognizing Common Allergy Parenting Traps. And that's a phrase I created to describe the oftentimes rigid behavioral patterns we will see from parents of kids with food allergies that in the short term keep safety there, but in the long term can create challenges for the child themselves and the whole family. The third chapter is setting developmentally focused allergy parenting goals, and that's where I go through ages and stages, looking at what is the goal of parents in general, what are the allergy parenting things we need to be teaching, conversations to have with clinicians, with each other, with co-parents, sort of helping them ground in what are we trying to do. Oh, by the way, overall, we're trying to raise a child who has self-efficacy in managing their own food allergies. How do we get there? The next chapter is responding differently to anxious thoughts. And so that really is a chapter that talks about fight or flight and fear and physical sensations of anxiety and what anxiety is, and helpful and unhelpful ways of navigating life with anxiety and making a different relationship and responding to anxiety differently. The next chapter is focusing on all that matters, not just allergy safety. Again, this is getting to the heart of ACT, which we'll talk about later. But that is really because we find in families that they are so focused on safety and not having allergic reactions that oftentimes they push away other important aspects of life and living. And so my plea in that chapter is to help them figure out how to balance safety and living fully. The next chapter I have is developing flexible perspectives on allergy parenting. Again, another ACT nod here to say, okay, this is what it is to live with food allergies. How can we navigate this with rules and guidelines to stay safe, but not in such a way that it's life limiting? And then the last chapter is putting your balanced, mindful allergy parenting plan into action. It kind of goes through a review of all the things that make parenting a child with food allergies feel overwhelming and anxiety inducing, and then walks you through, again, prompts, kind of a workbook style to help parents map out their mindful allergy parenting plan so they can get off of parenting on anxiety autopilot.
Fantastic. So that's all your book is about.
That's it.
Food allergy anxiety shows up in so many different ways. But
Yeah.
again, I really appreciated how you were able to identify specific patterns, right?
Yeah.
And when you realize that there's specific patterns and specific ways that it shows up, you begin to be able to use some of the concepts and tools from your book. And you're not saying that safety is less important. You're just saying that safety, yes, and, right?
Yep.
And other things are important.
Yeah. So research backs this up. This isn't a concept we therapists came up with, but we see this in practicality in our work, that the drive to keep our children safe combined with that intense anxiety often can distort our risk perception, which means that we can often think things and experiences are much riskier than they might actually be, because of course we want to keep our child safe. So that makes it harder for parents and families to assess risk accurately. That anxiety can totally skew things. When we're operating from that point of view, where everything is very risky, I must keep my child safe, which again, I say from the beginning of the book and in all of my work, I'm never trying to say we're not focusing on safety. However, anxiety pushes us to respond to the risk in ways we don't need to be. So that looks like engaging in overly rigid behaviors that, again, keep our children safe, but don't allow the child to learn how to manage their own food allergy. Don't allow them to learn how to socialize safely with food allergies. It becomes life limiting as the child continues to grow up. It also can impact family systems in other ways. Co-parents start bickering and having problems with how do we raise this child? Siblings, right? Sibling relationships. So it can impact the entire family system. Some of the ways in which we respond to anxiety can lead to parental burnout, quite honestly. We know we have to educate, advocate over and over and over again, and we will continue to do that. But how we do that and whether we let anxiety drive what we need to be doing to keep our child safe makes that difference and keeps us from having parental burnout.
It's so complicated because it's not
Yeah.
just it's not just the child. Each different parent can be having kind of different experiences And
And
then
I often find that, I'm sure you do, right? And so there could be risk tolerance level differences. There could be how to approach safety differences, right? And I'm sure clinicians see that in their offices as well.
absolutely. Yeah. And then from the parents' point of view, is my child old enough to actually learn how to be safe in these circumstances? And being willing to be safe enough to let your child take some baby steps as they're getting older.
The way that I talk to families about managing food allergy anxiety is this. I say the goal is not to completely extinguish food allergy anxiety, although it would feel lovely to do so. The goal is to understand it, to learn to respond to it differently, and to not let anxiety drive all of our decision making. Going back to the beginning of the talk, anxiety is not what is going to keep our child safe. The behaviors are what's going to keep our child safe. So we have to base those safety behaviors on things that are medically necessary rather than what our anxious mind tells us we need to be doing. Usually our anxious mind wants to go above and beyond to this unhelpful place. And so it's about adjusting behaviors, quite honestly, and that's really what I focus on, is helping families do that.
You're starting to use some language that's really straight out of acceptance and commitment therapy. And so I'd love to chat a little bit about acceptance and commitment therapy. May Contain Anxiety introduces parents to ways to apply acceptance and commitment therapy to their own lives and their own thinking. That may be the first time people have even heard of acceptance and
Yeah.
commitment therapy. Many people are at least a little bit familiar with CBT, or cognitive behavioral therapy. And that's the
Mhm.
kind of therapy that I used for a really long time. And I've learned acceptance and commitment therapy because of some of your mentorship, guidance, and support. And I've received additional training and now incorporate that into the work that I do. But let's talk a little bit about what some of the differences are. Cognitive behavioral therapy works on challenging unhelpful thoughts or automatic negative thoughts in order to change how we feel about a situation, in order
Mhm.
to shift our behavior. We might start with the thoughts, we might start with the feelings, we might start with the behavior. But thoughts, feelings, and behaviors are kind of the triad within CBT. And acceptance and commitment therapy shifts the thinking a little bit, using some of those same ideas, but looking at it differently in a way that I think actually works better for food allergy anxiety than CBT sometimes does. Can you talk
Yeah.
a little bit about ACT?
Yeah, and I'll say before I do that, CBT, as you said, is a wonderful approach. It's very effective for anxiety-based disorders. It's very effective for food allergy anxiety management. I know pretty much all of the research done in food allergy, mental health, and anxiety management is CBT focused. So I find it particularly useful for the kids who are not abstract thinkers, because ACT can sometimes require a little bit of that abstract thinking. But for in particular adults or parents, I find where ACT is very useful is, in CBT, as you said, we sometimes will debate truths. We'll sometimes get into that challenging space where we're going, well, is this really true? Is this just what I'm thinking? How do you debate your way out of, my child could eat something and have a food allergic reaction and die? It's a really hard debate. And as an
There's
allergy
just
parent,
enough truth in that one.
we can sit and tell parents that the statistics are low, but nobody wants their child to be a statistic. And as an allergy parent, this is an emotional diagnosis too. So I started looking at ACT as a way to sort of circumvent that, not even to get into that challenging debate. And so what ACT does is it's built on a concept called psychological flexibility. And psychological flexibility really is, can we get to a place in our life in the midst of struggle, in the face of struggle, like a challenging diagnosis or an adjustment in the way that we're living, be able to stay present, so not getting hooked by past pains and always using that as our frame of reference, or pulled into future focused worries and using that as our frame of reference to make decisions. Stay present with what's happening externally, internally, our thoughts, feelings, and memories, right? Same core concepts. We're just looking at this differently. So being able to stay present and then make our choices and our actions in life based on what matters to us. And so someone might say, well, all of that matters. Keeping our child safe matters, living a full life matters. Absolutely. And that comes back to having to learn how to manage the anxious thoughts and the food allergy anxiety so that we can do all of that. It encourages us to not stay stuck in patterns that don't work for us, like over avoiding things beyond what's medically necessary, like over functioning for our child as a way to manage our own anxiety and calm our own anxiety, which impacts the child's ability to learn how to live with food allergies, and also passes along this message that you're not capable of learning how to take care of yourself. So I'm the only one who can keep you safe. And so when food allergy anxiety shows up and we use ACT, it's that shift from, I'm anxious about my child's safety, so we're just not going to do that. We're going to avoid that experience. We're not going to go out to eat, to I'm noticing that I'm feeling anxious about my child's safety in this new experience. What actions can we take to have this experience and do it safely, right? We're always preparing for if there is a reaction, then we'll know what to do because we have our action plan, we have our epinephrine. That's part of that usefulness of anxiety. It helps us plan and prepare, but it helps us get unstuck and think that rigid behavior, we have to avoid anything that makes us anxious. And it helps us reframe, again, that's a CBT word, but basically reframe to say anxiety doesn't determine safety and risk levels. Anxiety is just not a good predictor of safety and risk levels.
Anxiety is going to overestimate the dangerousness. Yeah. And one of the ideas that I talk about a lot with my families that I'm working with is it underestimates our ability to deal.
Yep, our capabilities to, in the face of some risk, respond appropriately and stay safe. In the face of an allergic reaction, be able to use epinephrine and treat it appropriately and be fine.
I know that we received a question from one of the attendees today about safety and childcare, daycare, school, that kind of thing. Maybe we can touch on that question that was submitted. Yep. Because most of us do want our children to go to school. And in order to do that, we've got to put in a lot of work. Speaking of burnout, right? And having some really uncomfortable conversations, really advocating with the staff at the school.
Yep.
What are some ways that you talk with your families about balancing that safety if the value is having your child attend school and tolerating some of that discomfort, right?
And that's where I usually start off with, is the reality is that allergy parenting comes with a lot of discomfort. Parenting in general comes with a lot of discomfort. And we have to remind ourselves that that discomfort doesn't mean something's unsafe. It just means that it's new, it's something unknown, or we haven't built trust yet. In the case of going to school, especially if it's just starting preschool or those newer years, or going to a new school, maybe middle school, high school, right? These transitional periods are typically going to increase our anxiety as a parent because it's transitions, it's new, it's all the things that tend to trigger anxiety. Number one, I remind them about that. Number two, I remind them that they need to be going back or going to their allergist and allergy care team and having some of these, what I call foundational conversations, right? If we remind ourselves that our anxiety as a parent is going to tell us we have to do A, B, C, D, and E to keep our child safe, but the allergist is going, actually, really medically to keep the child safe, A, B, C is what you need. If we can do the others, great, but it's not necessary. It's just going to make us feel a little better. I'll tell parents to go back and talk to their allergist, create a list of accommodations that are non-negotiable, and that's language I'll use. Have those conversations with school, be open-minded. Again, we may not see eye to eye exactly on that. And to remind ourselves that this is about trust building. And so that goes back to that place of, even in those earlier years, we have to learn how to get through the discomfort of allowing others to learn how to take care of our child. And for us to learn that we are not the only person that can keep our child safe. That's what's going on in our mind, our rigid narrative going, we are the only one that can keep our child safe. So it's a pair between our allergist and allergy care team and conversations with the school and figuring out what non-negotiable accommodations we can put into place, challenging that uncomfortable and unhelpful narrative that we are the only one that can keep our child safe.
You're talking, you say so much in your blog, which is fantastic, by the way. I love it. My clients love it. And you talk so much in your book about helpful versus unhelpful anxiety, just associated with living, but most of all, living with food allergies and experiencing food allergy anxiety. Can you talk a little bit more about helpful anxiety? Because that it's a little bit confusing to talk about the anxiety that's helpful versus unhelpful, because it all just feels like anxiety.
Yep. And so the clinical terms are maladaptive versus adaptive anxiety. As you've seen, I tend to not use clinicalese, I don't use clinical terms to describe the clinical terms that I'm teaching people. So I use the term helpful versus unhelpful. And what I mean by that is we're trying to go from having our anxiety be a useful tool that helps us stay safe. We want that, what's what we want it to be. So usually we have to adjust it from being the life-limiting compass that's unhelpful, telling us everything is unsafe, right? If we have anxiety that's at manageable levels, it's that helpful tool because it's the thing that tells us to look both ways before crossing the street, to put our seatbelt on, to bring epinephrine, to read labels, to ask questions, to educate others, right? Those are all helpful tools to keep our child and ourselves safe. When it steps over that line to unhelpful and not as useful anymore is when it starts to dictate very rigid things like, you can't ever go out to eat, it's unsafe. There's no way to go to a play date. Parks are unsafe because somebody might be eating allergens, right? And so when we start to follow those rigid beliefs and we believe everything our anxious mind tells us, that's how we know it's a real clear indication we've crossed over that line into unhelpful anxiety. Because if we were to go have that conversation with our allergy care team, they would probably say, well, actually, the risk level for going to the park is not what your mind is telling you. It's pretty low. And here are a couple of things we can do to make sure that, you guys stay safe. Wipe hands, some helpful protective things that at manageable levels of anxiety, we probably would have been focused on. We're not able to access that kind of helpfulness that anxiety can be for us.
Safe enough in the example that you gave would be making sure that your hands get washed after you play at the park and having clean hands when you eat your own lunch.
I use those terms. It's funny, I've had a conversation with a couple of allergists. One's coming out actually with Dr. Adam Fox soon, and we had this exact conversation. He's in the UK. I think we try to talk in terms of safe and unsafe, right? Would we love to be able to put everything into one of two buckets, safe or unsafe? 100% would make life a lot easier, right? This is safe for your life with allergies. This is unsafe. However, unfortunately, risk and safety live on a continuum. And so very rarely do we get complete certainty that something's 100% safe or 100% unsafe. When we do, we celebrate, we love it. It's very clear. Also, what I will tell medical professionals is that, in our work, we work within the gray, and we want to push people sometimes into that gray. And so that term safe enough is a way to do that. It's a way to shift behavior away from, I need 100% certainty on something in order for us to even try it, because a lot of times we're not going to get that. But that also doesn't mean it's 100% unsafe if we don't have that certainty that anxiety says we need to have. Safe enough, which is a huge wide range, is that phrase that many of us use in this field to say, okay, we can either adapt things to make it safe enough by using preparation and bring our own food or whatever, or our allergist and allergy care team can tell us, actually, that is safe enough for you to be doing, just do X, Y, and Z.
And that really speaks to the necessity of collaborating between mental
Yeah.
health and physical health, what's medically necessary, because you might have one 9-year-old with dairy, egg, and peanut who needs to be managed differently than another 9-year-old with milk, egg, and peanut, right?
Yep.
And
Yep.
as mental health professionals, we're not the ones to give the medical guidance. We really rely on the family to get that guidance from the doctor.
100%. And I say that very clearly up front in all of my work. It's outside of our scope to give medical guidance. Again, it's very nuanced. It's an art and science managing food allergies, and it's not within our scope and our role. And so we help guide families to come back to the medical team to ask specific questions or talk about specific topics to help them get all this important information that we can then use in therapy to manage the anxiety.
Mhm. In evaluating experiences, I love the section in the book. I actually highlighted it and bookmarked that section because I use it so much with my food allergy families. The section on page 54. Would you be willing to read a little segment out of that one?
Yeah, and what you're talking about is what I often talk about, and I'll share a little bit more here in a second, is shifting that mindset from it's about avoiding all risk at all times for all things to keep our child safe to it's about building skills to learn how to assess safety and risk and to learn how to navigate risk safely. That's that mindset shift, right? So
Mhm.
in order to help families do that, on page 54, 55 of my book, I talk about how important it is to have these conversations with the healthcare team, the allergy care team. Sometimes allergy care teams will proactively bring these conversations up, but if they don't, I want to empower people to be an empowered patient and talk about this. And so some of these conversations I guide these families to have anywhere along the allergy journey, at the beginning with the diagnosis, at any point that they're finding themselves very anxious, at a transitional point, is to talk about the following. How do I accurately determine what experiences or situations are too risky for my child and which ones are safe enough? Again, that terminology. How worried should I be about my child being near, touching, or smelling their allergen and potentially experiencing an allergic reaction or anaphylaxis as a result? So there, obviously, I'm getting at non-ingestion exposure conversations, right? Asking allergy care teams about how should I navigate precautionary allergen labeling. We see these conversations, hear these conversations all the time. They are anxiety inducing. So have that conversation with the care team. How should I address situation specific topics, such as how to safely navigate air travel, school parties, eating out, getting vaccinations, and so on? You should also talk with allergy care team, and I would flip this for the providers and say, think about talking with your families about this or provide handouts with general guidance on this and educate, because families need to know strategies for safely navigating potential risks relating to food introductions, oral food challenges, and food allergy treatments, and any information that you found online about allergy related risks and safety that induces anxiety and worry, excessive avoidance of situations, or that you want to fact check, right? There's a lot of misinformation out there. So there's a lot of lack of information. There's a lot of misinformation. And so in order to help families manage anxiety around food allergies, they have to learn how to assess risk effectively, not assess it based on what our anxiety tells us is risky and safe.
Asking the expert that you have on your team and balancing that out with your own tolerance for anxiety and some of the ambiguity about that safe enough idea. I love how you talk about the importance of collaborating with your food allergy care team because we've all got to figure these things out. There's so many different factors that
Yeah.
impact families' decisions about how to navigate different situations from school to sports to daycare to moving from elementary to middle school.
That's a key thing to remind that anxiety often does, understandably so, increase, not hopefully for long periods of time, but temporarily during any of those transitional changes and new experiences. Anxiety, again, can be a helpful tool to remind you to seek safety and security, but it doesn't automatically mean something is unsafe to be doing. So that's that clear distinction. And having these conversations with your care team can help you get that information to make those decisions and interact with your food allergy anxiety in a way where it's not telling you how to live your life and limiting your life. The way that I love my metaphors, that's an ACT therapist for you. We use a lot of metaphors to describe things. What I put in the book too is also that regarding food allergy guidelines, and I think this is a good way for clinicians to even share this information is, yes, there's guidelines out there, right? Carry 2-epinephrine auto-injectors, avoid your allergens, right? There's a set of guidelines we're all familiar with when we live with food allergies. How I'm positioning this is that we need to try and fit the guidelines into our lives, not fit our lives into the guidelines, right? So we need to say we still want to do things as a family, travel, have experiences, live a full life. So how can we apply all of these food allergy and safety guidelines in a way that still allow us to do that and manage that risk versus trying to shove our life into what feels like a hole this big to stay safe? And that is that mindset shift that I keep talking about in the book and that I talk about in all the work and education I do.
And so much of the work that food allergy informed therapists work on is exactly that, and also navigating those big jumps in developmental level, right? Going
Yep.
from being at home to being in TK or preschool, wanting for your child to have freedom to be able to go to a sleepover or a birthday party and not have mom sitting there when you're 12. That's not comfortable anymore, right?
No, and it also impacts that parent-child relationship. And so as family therapists, trained, family therapists, we're thinking of those things too. Again, the reality may be you may talk to your allergy care team and you guys, based on your own allergy profile, may decide, yeah, there are these experiences like sleepovers or eating out that it's not safe enough. We can't do it in a way that seems safe enough. And so we're deciding that those are not things we're going to be doing. But where I challenge people to do this differently is to say that decision needs to be based on medical necessity of safety, not based on how anxious we feel about an experience. That's that pivot, right? And so that's what this work is all about that we do. And that's what I pumped all into the book is this mindset shift so that, yes, anxiety is still here. Look, I have a 16-year-old with a food allergy. Guess what I'm getting ready to do? Send him to college. I just had one go off, right? So I know what's coming. I'm a therapist who's been doing this work for a long time. I still experience food allergy anxiety, right? It's learning how to manage, still live our lives with it. Keep in mind that our goal is to raise kids who are able to manage their own food allergies on their own. And the clinicians are part of that process. This is a team effort.
In addition to your really wonderful book that came out in the fall, and this is now available everywhere, right?
It's available worldwide now. It is available in paperback, hardcover, ebook, and audiobook worldwide.
You also have an outstanding blog and newsletter. And you just recently did a whole series about helpful and unhelpful anxiety that I've been hearing lots about from some of the food allergy families that I work with. Can you share a little bit more about your resources for families and for other food allergy informed mental health professionals as well?
Yeah, and again, I've heard from allergists and NPs and PAs that this stuff is helpful for them as well because it gives them language to use with their patient families. Foodallergycounselor.com is what kicked all this off years ago. I was this allergy parent who was going through the struggle myself after receiving the diagnosis for my son. And so I started writing my articles on the blog on foodallergycounselor.com. People started to get wind of it and then reach out to see if I could be their therapist. And unfortunately, because of licensure laws, we can only work with people in the states in which we're licensed to provide therapy. So I'm in Illinois. I'm licensed here in Illinois. I'm also licensed in Ohio. I had to seek separate licensure process for that, which is not easy. And I also have a telehealth license for Florida. So I can service people via therapy in those not that many states, 3 states, even via telehealth. Other clinicians must be out there doing this work or aware of it. It's how you and I connected years ago. I went on Google and said, find me the other people doing this work and or interested in it. And so connected with you. Next thing you know, I started what was called at the time the Food Allergy Counselor Professional Network and a directory. So I old schooled it, had just a page with a list of people by state who did this work, and I was the person who was the point person. And now that has turned into the Academy of Food Allergy Counseling, which for families and clinicians offers a directory of allergy-informed therapists, licensed therapists, state by state, and even some in Canada. And for therapists, it offers education. This niche is being built. We're trying to formalize this niche, just like you see that people with diabetes and cancer receive support. People with food allergies and allergic diseases need the same kind of support. And so we're building that. So that's kind of how it led into all of that. I also recently was invited to start a Psychology Today blog, and I titled it Food Allergy Parenting. So I'll be writing on all things food allergy, family, and life related on there as well.
You've been featured a number of times in Allergic Living as well, and now on their online publication, but also in the podcast that they have as well, right?
I love Allergic Living. It's a great resource.
You are really active. I admire how active you are on social media. Your LinkedIn posts always pop up first.
I create a lot of work for myself, let's just say that. And so I am always trying to make sure I don't burn out either. But the joke in my family is my husband said, this is a wonderful hobby about 10 years ago to help the food allergy community. I didn't know what the plan was, I certainly never intended to write a book or start a Academy of Food Allergy Counseling or a director, any of these things, but my heart led me in a direction where I saw there was a gap in resources and I felt it personally. And so I just followed it. And this is where it took all of these resources to help us have these kinds of conversations that are so very important to be having.
If somebody wanted to get a taste of some of your articles, what are some of the best places that they might be able to follow up and learn more until the book arrives in their hand?
Foodallergycounselor.com, so www.foodallergycounselor.com. Oftentimes I'll write articles there. I also used to host a podcast called Exploring Food Allergy Families about 4 or 5 years ago. And so there's podcast episodes there. People can find those on your favorite podcast apps as well. Psychology Today, I now have a food allergy related blog there as well. On social media, I basically do microblogging, so people can find me. Primarily, my food allergy social media handle is at Food Allergy Counselor, and I'm primarily on Instagram and Facebook. I also have at Therapist Tamara, which is just more general, because the other side of my practice is just supporting women and moms through anxiety, stress management, and life adjustments.
If somebody isn't in Ohio, Florida, or Illinois, where can they go to seek out a therapist that does the kind of work that you do?
Such an important question. And I'm so glad that you brought us back to that. Yes, the Academy of Food Allergy Counseling and its therapist directory can be found at www.foodallergycounseling.org. Again, that was what I originally created, which lived on my food allergy counselor website. And I should say, people can still get to it from my food allergy counselor website, foodallergycounselor.com. There's a link in the menu bar that says therapist directory, and it takes people to the Academy of Food Allergy Counseling, where the therapist directory now lives.
Wonderful. I'm hoping that people will come away from today's program feeling like they can get this book, and there are also so many other ways of being able to learn more
Yeah.
about these different ways of shifting that thinking, right? I'd love to see if we have maybe one question, if there are any questions that people want to add into the chat. The one caveat that I want to say is to please remember that while both of us are licensed therapists, we're not your therapist. We haven't done a comprehensive assessment. We can talk about ideas from the book. We can talk about concepts. We can talk about therapeutic approaches, but we're not really able to offer like specific consultation over Zoom, right? Any more than our doctors can provide us with medical advice over Zoom, right? But I would welcome people to ask questions perhaps about the book or therapeutic approaches. If people do have questions about ACT or CBT, some of those differences, I'm sure when we follow up and post this video on the Sean Parker Center website, we'll also make sure to post some of the really helpful resources that you've listed here.
And even if clinicians have questions about supporting families too.
I love being able to offer support for the staff here at Stanford, as well as offer support for the participants in the different clinical trials. And I really think about, for the people who are signing up for these clinical trials and learning about them, that is what we would call a values-based action, right? That people are actively taking steps to try and ensure that their children will be safe. And it's hard and it's a lot of
Yeah.
work. And people stick with it when it is grounded in the values that we have, right?
Yeah, I'm very familiar with trials and treatment and all of that, oral food challenges, absolutely.
I know that this has been, Tina has a question.
Thank you so much, Tamara and Marta. That was so fascinating, so exciting. I'm curious, and I don't know if there's data on this, but I'd love to hear your insight into this. And this is more curiosity on my end, because I see so much food allergy related anxiety, right? That is so focused on really the food allergy element of their lives. And, as we find a way that works for them, either through oral immunotherapy or with other treatment options, something that actually helps the child kind of venture out, reduce the hypervigilance that they go through daily. Do you ever find, like, longer term, that some of these kiddos, does the anxiety come back in a different form in the future? Like, are they at a higher risk for generalized anxiety disorder down the line? I'm just curious, because in our mind, the allergy kind of silo, we're like, oh, great, you're doing so much better. Okay. But I'm always curious, long term, what do we see and what do we look out for?
Yeah, what I can say is obviously from the research, those of us who are well versed in that, we know that, just like you said, food allergy anxiety is a different construct and different kind of anxiety than a generalized anxiety diagnosis, right? So, but yes, I mean, I think again, we're looking at we're looking at people's coping styles, if they have a tendency or learned behaviors about a more anxious response, then it is entirely possible and even maybe likely that down the line they could develop anxiety again, or anxiety focused on different areas of their lives where it might look more generalized. So I do believe there is a predisposition or a connection where if a child, especially if they've been living with food allergy anxiety for a while, it's something that has been a challenge for a long time, and they've learned how to manage it, and they've had maybe treatment and their life has changed, the risk levels have changed. Certainly, I think there is research to say that there could be a connection. Absolutely. Marta, I don't know if you have...
An interesting question came in through the chat, and I'm going to paraphrase, not read the entire thing, but I know this is something that we've talked about in some of our consultations. And this has to do with ways that anxiety responses, racing heart, and other kinds of really physical anxiety symptoms and allergy symptoms, how similar those
Yep.
can be, and how
Yep.
tricky it can sometimes be to differentiate those. And sometimes one can even make the other worse, right?
Mhm.
Can you touch a little bit on that idea about how they're
Yeah.
different, how they overlap, and how they might contribute to each other?
Yeah, I'm not going to lie. Sometimes it's very hard to determine and decipher the difference between the two because the same system is involved in both responses. So the guidance I often give in that case is, again, go back to the allergist and allergy care team to really discuss that and see if together they can come up with any clear indicators that would help decipher the difference between the two. I also encourage people to do a couple of things. Number one, to observe the physical symptoms of anxiety in situations outside of anything having to do with foods and food allergy so that they can observe and get to know in their body, oh, when I'm anxious, my stomach gets upset. Oh, when I'm anxious, I feel like my throat is, scratchy, itchy. The breathing is more difficult, right? More shallow, which is a very common response to anxiety and anxiety symptoms. And then also to try some grounding based exercises that might look like deep belly breathing, where the exhale is a little bit longer to kind of induce that rest and digest response instead of that fight or flight response in our body, to do a strategy called 5-4-3-2-1, which is engaging our senses, basically to see if we can notice a calming of the symptoms. Oh, that's probably anxiety based versus a escalation of symptoms. And also to do that mental check of, was I just eating? Is there anything that was extra risk? I will say I'm leading a project. I'm not sure when it'll come to fruition, but I'm leading a project with the American Academy of Allergy, Asthma Immunology. A team of mental health professionals and allergists are putting together a handout on this topic that will hopefully be a free resource for people to help them understand and learn and managing the anxious symptoms in those kinds of situations, at least
I
adults
love
anyhow.
I love the idea of taking the time to learn about your own anxious
Yep.
responses separate from food, right? And learn, how does your body respond? What does anxiety feel like for you? So that if you are, for instance, going to do a food challenge or something like that, you already know, and you already know how your body feels, and you already know anxiety reduction strategies and what works, because 3 deep breaths doesn't work the same way for everybody,
Yeah.
right? It's different for different people. By using anxiety management strategies, you can at least try to reduce a little bit of that confusion, but there may well be some
Yep.
confusion. For
Yep.
instance, with an upset tummy, that's a tough one, right?
Yeah. And I would say, if you are someone or your child is someone where that is happening, go back to your allergy care team and have that discussion about, if I'm unable to decipher between the two, what should I do? And likely the guidance is going to be, when in doubt, use epinephrine if you really think there's a risk of an allergic reaction and you think that's what's happening. But again, not
He
a
doesn't,
doctor, not giving medical
right.
advice. Talk to your.
But the doctors are likely to say treat medically,
Yep.
and we'll work with the feelings. And with that, we will need to call it a day. Tamara, thank you. Thank you so much.
Thank you for Stanford and everyone, Marta. Thank you so much for inviting me to come on and chat, and for sharing these resources to help people connect with clinicians who understand and can help them manage their anxiety and to just live a good quality of life, even with food allergies.
The book, which I would love to recommend, may contain anxiety. Please do seek out additional information about Tamara's work and take a look at the Academy of Food Allergy Counselors. If you are feeling like you could really use some additional support, self-help books are valuable and wonderful, and many people find that it's just the tip of the iceberg. It's the first step, but not enough. And we can offer a wide range of support for families who are facing that anxiety experience. Thank you so much for joining us this evening,
Thank you.
Tamara. Thank you, Tina.
Thank you both so much. That was amazing.